you doing today, Nick?
Good.
Good. So my name's Cole, and I'm going to be your student physical therapist working with you today under the direction of Dr. Sykes. Okay. So what we want to do today is just get a better idea of exactly what's going on. You said you had some pain up in your neck, as well as your kind of low back, as well as kind of all throughout your spine. Is that correct? So we just want to be able to get a couple numbers to be able to objectify exactly what's going on, so we can create the best treatment plan for you. Okay.
Sure.
So to be able to do that and to treat you to the best of my ability, it'd be really beneficial to be able to see some of those structures that we're going to be treating. So to be able to do that, if you would feel comfortable with removing your shirt, that would be helpful. Is that something you feel comfortable with?
For sure.
Okay, what I'll do is I'll just leave the room really quick, and then I'll be right back in just a minute. I'll come knock on the door. You let me know if you're ready. Okay?
Come in.
All right, how you doing, Nick?
Good.
Good. All right, so the first thing that I'll have you do, I'll just have you lay down on the table, if you're all right with that. And the first thing that we're going to test is just some of those neck muscles with the neck flexion, okay? So I'm going to be putting my hand on the back of your head, as well as like down your spine, as we go through some of these tests and measures.
Okay.
Is that something that you feel comfortable with?
Yeah, for sure.
Okay, awesome. So what I'm going to have you do is I'm going to have you reach your nose up to the roof of the ceiling, okay? Okay, good job. And then come back down. Okay, any pain with that?
Mm-mm.
Okay, perfect. So I'm going to have you do that one more time. Okay, and then I'm just going to place 2 fingers on your head, and I'm going to push you straight back down.
Okay.
You're going to go ahead and try and resist me, okay?
Right.
Ready? Push, 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 push. Okay, go ahead and relax. All right, how did that feel?
Good.
Okay, no pain with that at all?
Mm-mm.
Okay, so the muscle that we're testing there is the sternocleidomastoid, okay? So that has attachments up at the mastoid process, as well as the sternum and then the clavicle, okay? And then it looked like you were a 5 out of 5, okay? So you were able to hold against max resistance. So if you would have broken with moderate resistance, then you would have been a 4 out of 5. If you were only able to get up to the position without being able to hold against any resistance, you would have been a 3 out of 5. If you were only able to go through that partial range of motion, then you would have been a 2 out of 5. And then if we weren't able to lift your head up, but we were able to feel a muscle contraction, then you would have been a 1 out of 5. And then without that muscle contraction, you would have been a 0 out of 5, okay?
Okay.
All right, Nick, so the next thing that we're going to be testing is some of your trunk flexors, mainly the rectus abdominis, okay? So what I'm going to do is I'm going to brace your knees down here. You don't have any problems with your knees that would have pain with me putting my hands on them, do you?
No.
Okay, perfect. So I'm going to hold you right here, right above your knees, and then I'm going to have you bring your nose as far up to the ceiling, kind of like you're doing a crunch for me, okay? And then what you're going to do before you do that is you're going to put your hands behind your head, just like this, okay? Perfect. And go ahead. All right, and back down. Any pain with that?
Mm-mm.
Okay, perfect. So since you were able to clear the inferior angle of your scapula with your hands behind your head, we'd have you as a 5 out of 5. Okay, and the main muscle that's doing that is your rectus abdominis, and then that has attachments on the xiphoid process, as well as the costal cartilages of ribs 5 through 7, and then it comes down and attaches mainly on the pubic symphysis. Okay, if you weren't able to do it with your hands behind your head, the next thing that we would have you do is put your hands on your shoulders, just like this. And then if you were able to clear the inferior angle in this position, then we'd give you a 4 out of 5. And if not, then we'd have you bring your arms down to your side. And then if you were able to clear them in this position, then we would give you a 3 out of 5, okay? And then if you're only able to go up partially, then we'd give you a 2 out of 5. And then there's a couple other ways that we can get you a 2 out of 5. If I was able to come and then lift you up, and then you were able to assist me, and we were able to see rib depression, then you'd also get a 2 out of 5. Or sometimes if the patient or you could cough, and then we could see that rib depression, and it'll activate those muscles. And then that would also give you a 2 out of 5. If you were unable to get that rib depression, but we were able to palpate a muscle contraction, then it would be a 1 out of 5. And then if we weren't able to palpate a muscle contraction, then it would be a 0 out of 5. Okay?
Okay.
And then when we were going through those, did you have any pain or any questions about those?
No.
Okay, sounds good. All right, Nick, so what we're going to do is we're just going to test your cervical flexion. Okay. So the landmarks that we're going to be using to do that is your external acoustic meatus, as well as your nose, or just your ear to your nose. Okay. So what we want is the normal range of motion is usually around 0 degrees to 50 degrees. Okay. So the first thing that we're going to do is we're just going to get an idea of your normal active range of motion. So what I'm going to have you do is bring your chin down to your chest for me. Okay. Perfect. And was there any pain with that or any discomfort?
No.
Okay. And then we're just going to put a number to that motion. So what I'm going to do is I'm going to use this tool. It's called a goniometer to help me get that number. Is that something you feel comfortable with?
Yeah.
Okay. Sounds good. All right. And then go ahead and bring your chin down to your chest. Okay. And you are at 45 degrees. So, like I said, the normals are around 50. You're really close to there, so it's nothing to be concerned about at all. So you're right where we want you as far as that range of motion goes. Okay?
Great.
Sounds good. The next thing that we're going to measure is just your trunk flexion. Before we do that, what I'm going to do is just make a couple of marks of the landmarks that we're going to use. Is that something you'd feel comfortable with?
Fine.
I'm just going to put a little teeny dot where I'm going to be measuring. All right. So what I'm going to have you do is I'm going to have you lay down on your stomach. Let me pull this out so it's a little bit more comfortable for you. Are you comfortable in that position?
Yep.
Okay. And then one of the landmarks is just going to be a little bit lower. Do you care if I bring your shorts down just a little bit?
No.
Okay. Okay. And then what I'm going to do is I'm going to palpate on the iliac crest. Okay. And then I'm going to come down to the PSIS. Okay, which is right here. Then I'm going to come just medial to that. And then I'll feel for my S2 and then just make sure, come off the sacrum, which is right here. Okay. And then we're going to go up to T12. So I'm going to palpate for the 12th rib, which is right here. And then I will come just medial to that. And then there's the spinous process of the T12. All right, perfect. And then we're just going to use those couple dots to be able to get some measurements here in just a second, okay?
Okay.
Next, so we're just going to test your lumbar flexion, okay? So the landmarks that we're going to be using is your S2 as well as your T12, okay? And then what I'm going to be using is just a little tape measure, so we'll have it at those two structures. So that's just about right here, up to about right here on your back, okay? And so what I'm going to have you do is I'm going to have you bend over and reach down to your toes, okay? And then I'm just going to give a little bit of overpressure. Is it alright if I put my arms on you?
Yep.
Okay. Alright, and then you can come and stand back up. And then we put those little marks on you. So is it alright if I have you bring your shorts down just a little bit so I can see that other mark? Okay, perfect. Alright, and it looks like you are at 11. Okay, so I'm going to have you reach down and touch your toes. Okay, and looks like you are at 19. So that's about 8 centimeters of flexion, okay? And if we were measuring that with a goniometer and inclinometer, it'd be around, the normal range of motion is about 0 degrees to 50 degrees. But measuring it with this, we're just gonna keep track and see how you progress to see if we can get more or if there's less motion as we move forward, okay?
Awesome.